Welcome to the Understanding Dementia Care video series, where we'll do a deep dive into building a data-driven dementia care model by evaluating comprehensive components of dementia care. I'm Dr. Micah Segelman, a health policy researcher at RTI International. I utilize health services research methods to inform policy, particularly in the area of care for the elderly. Our guest today is Dr. David Reuben, Director for the Multi-Campus Program in Geriatrics Medicine and Gerontology, and Chief Division of Geriatrics at the University of California, Los Angeles. Dr. Reuben was also the past president of the American Geriatric Society and has served and continues to serve in numerous other roles, including as the director of UCLA's Alzheimer's and Dementia Care Program, which will be our focus today. Thank you for joining us, Dr. Reuben.
My pleasure. Thank you.
Dr. Reuben, when did you start working on developing a comprehensive model for dementia care?
Well, I originally started before there was that I helped develop a comprehensive dementia care program. I was doing a lot of work in trying to improve the quality of care for dementia among primary care providers. And the problem is it wasn't working. So we had, after a number of failed attempts, we decided that it really needed to be somebody's job to provide comprehensive dementia care. So with that, we created a program where somebody's sole responsibility was to provide comprehensive dementia care.
And were you one of the earliest physicians to go in this direction and to try to implement this type of approach?
Well, I would like to say yes, but no. So there are a number of people who, physicians and other health professionals who antedated me and came up with very good programs, including in Indiana, which was the original muse for our program. But I have been doing quality improvement work for several decades, and you know, early on the programs weren't working. The physicians liked them, but it wasn't improving the quality of care. So we had to try a different approach.
Can you tell me how it is that you saw that it wasn't improving the quality of care in the way that you had hoped, and also the part about having one person whose job it was to really, you know, provide this comprehensive care? Who was that right person for that job?
Okay, so first, how did we know it wasn't working? We measured the care, and there are things that are called quality indicators. They're typically if-then statements. If somebody has dementia, then they should be screened for depression. Their medication should be reviewed, those kind of things. And we couldn't get the needle to budge using typical quality improvement methods. So we would spend a lot of time with these primary care docs. We would give them templates. We would monitor their progress, and we couldn't get the quality of care much above 40% of quality indicators being met. And then even when we added a nurse practitioner to their practice who was kind of undifferentiated, could handle a number of different conditions, we still couldn't get it above 60%. But when we had a nurse practitioner whose sole job was to provide dementia care to a population of patients, we got the quality of care over 90%. So the core of the program is an advanced practice provider. Here at UCLA, we have always used nurse practitioners, but other places are utilizing physician's assistant and clinical nurse specialists. But the key is they have to have prescribing ability.
So that's the nurse practitioner has to have the ability, in addition to coordinating the care, also to be able to prescribe.
Correct. And we had a lot of discussions about what level of provider this person should be. And eventually we decided on a nurse practitioner. At the time, it was all nurse practitioners, because they had good clinical assessment skills, they could prescribe, and to be honest with you, the primary care providers related well to them, much better than nurses or social workers, to be honest.
And so would you say that it's the nurse practitioner that is the reason why the comprehensive approach to dementia care is so important, or are there other aspects that you feel are super important?
So the nurse practitioner is the captain of the team, but it's not just having a nurse practitioner there. The nurse practitioner has roles and responsibilities. And we were just looking at this very recently. There are 14 core elements that our dementia care specialists, is what we call them, perform. Not every person gets every one of the 14, but as they need it, they choose from 14 different kinds of components.
And that's Dr. Reuben, thank you so much for providing all those insights.